Yeah, this is AA4FL for the Medical Image Radio Council, Grand Rounds in the Air. We're talking about, or speaking about the panel discussion amongst our members, preventing sports injuries today. So can sports injuries be prevented or minimized? And it's sort of a public service presentation, but it's not just a presentation, this is a true net. And we're going to be having a roundtable discussion about that as much as propagation allows. We do have the option of having Zoom for our members that don't have the propagation. We're also known as Healthcare Hams. You can see us on the internet at healthcarehams.org or marco-ltd.org, either one. Will get you to our organization. So, in the context here, there's suggestions that we're going to consider. It's not medical advice, but it's thoughts to consider. The Grand Rounds of the Air is a ham radio net. It's live on shortwave radio with discussion led by Net Control Station, the moderator who keeps it organized. And today that's AA4FL in Hawthorne, Florida. And note the call signs are the individual radio license IDs issued by the FCC, and you'll hear individual contributors offering their call signs. And many of our members are health professionals, but all amateur radio operators are encouraged to participate. And of course, this is available to the general public as well. We are in the public airwaves. Our healthcare members are active in many professions and specialties, but we also have members that are pilots and people that are in IT and research. We're a very vibrant organization. Future discussion panels will cover the sports industries that can occur. Today, we're just talking about generalities and information that all amateur radio operators that do get away from their microphone and get out and exercise should be well aware of. So a live web stream is available at marcoaudio.net as well as a recorded stream for future listening. But you really need to know your limitations. You got to use common sense in choosing a recreational sport activity. It can be a health benefit, but does come with some risk. Many injuries are caused by awkward falls, so you select a sport that you enjoy. But most offer you one that offers you the least risk or the controlled risk. And overexertion itself can result in injuries caused by strenuous or repetitive motions. I mean, we see that even in careers and vocations. Having a history of an injury should be considered in the context of your activity, and a vigorous sports activity is planned. Make sure you are medically able to do so. And if doubt, talk to your health provider. Make sure to always clear extreme activities or answer those questions before a problem occurs. But if you go in online and just look at general information and you browse for sports injuries, common sports injuries, you'll find information like I found from Johns Hopkins Medicine on common sports injuries, which included improper or poor training practices contributing to them, wearing improper sporting gear. And I've experienced that in my own family with someone breaking wrists of not having proper shoes on while playing tennis, but being in poor health condition. Obviously, you got to know your limitations. And they stated improper warm-up or stretching practices before a sporting event or exercise. And we're going to talk a little bit more about that later, because there's actually some information that contradicts that. So that's why it's important to get information from various sources. They also stated that the more common sports injuries include strains and sprains, joint injuries such as the knee, muscle injuries, dislocations, fractures, Achilles tendons, pain along the shin bone. They didn't mention concussion, so it's not a complete list. So as we talk about this today, we're going to be pausing the Net Control Station so that we do have time for questions and identification. This is AA4FL for the Medical Amateur Radio Council. We're in Rounds of the Air and taking additional check-ins at this time. Make your call.
Oh, 4, well, I'm a little bit early.
Oh my gosh, how are you putting out such a wonderful signal from Parks on the Air, Bob? Over.
We're running an inverted V and about 20 feet. Other V's inverted V and sit here in a perfect circle. Tell Mountain State Park, a wonderful day in the mountains. And as far as sports injuries, we're going to go climb a mountain in a little while. But you're 40 over 9 here.
Okay, well, we've got a direct pipeline. You're 5x9 here into Florida. We have K4 RLC, and actually, Bob was the comments was next up on the list here in our discussions because sports participation can be great for kids. And Dr. Alana K4 AAC and Bob Conder K4 RLC. I mean that's their areas, neuropsychologists, and. Bob, I was going to mention some of your bullet points, and if you're not online to see them as I describing them, but building self-esteem and developing self-discipline and character and helping kids learn the importance of teamwork. But there's a significant issue with prevention. There's a lot of junk out there with people trying to sell parents and school systems items that may not work. And I think you also mentioned in your email that prevention can be focused through legislation on the state level. So why don't you go ahead and talk a little bit about that, why propagation gods are in our favor. Over.
4FL, 4RLC with 34A, the picnic table. Okay, so yeah, we have absolutely no internet. It's really sort of weird, but no internet up here. So, and radio can get through. And, yeah, the bullet points, for a good sports participation, particularly on self-esteem, self-discipline, motivation, learning to work as a team. I think those are all sort of character building things. And we encourage our kids with a lot of recreational stuff through the YMCA programs. And the legislation, what happened with a lot of sports is that there was no legislation or prevention and no athletic trainers for organized sports. And for a lot of injuries, not just concussions, but disease injuries and other muscular injuries. So I was very lucky in North Carolina. As North Carolina Neuropsychological Society to work with Dr. Kevin Guskowitz, who has been chancellor of the University of North Carolina. And a lot of people don't know, Kevin started as a trainer for the Steelers as an undergrad in Pittsburgh. And he and Josh Bloom, one of the head docs for our hockey team, the Carolina Hurricanes. Josh had been a quarterback at Dartmouth, Ivy League football. So we got together and used model legislation to mandate safety pretty much for kids. And we would try to get an athletic trainer in every school, but that's a little expensive. Kevin used to say, if you can't afford an athletic trainer, you shouldn't have a sports program. I'm going to turn over to K4AAC, and she can add something if that's okay.
Well, please do. K4AAC, go ahead and take the mic. This is AA4FL with the Medical Amateur Radio Council. Grand Rounds on the air net.
AA4FL, this is K4AAC. Yeah, I think Bob did a great job. The scope of the Gefeller Waller law that Bob and the two other docs that he's talking about to help to propose is very all-encompassing. It is only applied for the public school system because you can't mandate private schools to and use recreational sports the same way you can in public schools that are under the law. But it was very, very diverse in terms of what it was talking about in terms of return to play guidelines and needing to be assessed on the field to make sure that before you were returned into the game. And fairly quickly after it was shown to be working so well, was adopted by the non-public schools, the private school systems in many of our areas, which like our kids attended. We developed a sports management and prevention program at that school and wrote about it. It got adopted in a lot of other places. So it was really very, very helpful to know that it was a total program. For AAC. In terms of looking at how to keep kids from playing, but also having there be an educational piece for the parents, teachers, return to play guidelines, even extending to return to learn, so that when kids came back, they weren't doing cognitive activities at the same level for a brief period of time, and had support for that with the teachers and the administration. So it's a wonderful program. We can talk more about it when we're going to be talking in a few weeks. But anyway, I'm glad that we got through. That's a miracle. K4AC.
Okay, totally unexpected here. You're doing a POTA and you're 5'9" here in Florida from Western North Carolina. Thank you very much for taking the time out of your busy weekend doing the activation. And thank you for doing that for Amateur Radio. And as Alana just mentioned, Dr. Alana just mentioned, we're going to be doing a future panel discussion on concussions, probably sometime in early November, and we'll publish that date. And this is sort of an introductory presentation today. We're identifying some of the ways to perhaps prevent sports injuries. But once we determine what sports injuries are most common, we're going to start talking about the individual injuries in upcoming months. So at the beginning of the school year, it's extremely important here. Again, this is AA4FL identifying for the Medical Amateur Radio Council, Grand Mounds and Internet. But today in the media, there was a story, and actually the high school student was in Port St. Joe. This was not a traumatic brain injury, but it was a football player who passed away during a game. I'm familiar with that particular community up in the Panhandle of Florida. Been to that area and have friends that live there. But in the article that I read today online, it said there were 7 deaths already this year from high school football players. 2 of them were traumatic brain injuries. So concussion and preventing concussions, you can never be. We're going to talk about helmets later in the presentation, but we certainly want to try to avoid wherever possible and decrease the risk wherever possible. Now, we had Mary earlier with us, AE4BX, and she's not available right now, but she did email me with a story, a parental story about her son who wanted to play football. And Mary is a doc, a physician, and of course she did not want her son to assume that risk. And she said when he ended up going off to college, I can't remember which of the excellent colleges he went to right now, but he ended up being a cheerleader, and he was very muscular, lifting the female cheerleaders into the air. That was his participation. And they asked him why he didn't play football, and his answer was, because of my mother. And of course, when they started to give him grief over his mother telling him he couldn't play football, he had to point out, you don't know my mother. And of course, being a physician, mother knew best in this particular case. And I'm sure he had an excellent career as a cheerleader if he had missed out on the football participation at the college level and the high school level. Thank you very much for Alana and Bob checking in today. Do we have any other, anybody else that would like to check and be involved in this roundtable discussion? Make a call to AA4FL. Okay, at this time, I have no further check-ins. And for those of you in the general amateur community that are listening and not actually checking in, do realize that we're having a discussion amongst our members, but it's intended to benefit all amateurs. And that's the nature of our net every week, is that our passion is medical related topics in amateur radio, tying up to amateur radio. And this is how we make our profession's hobby integrated here by using amateur radio to talk amongst friends about topics that interest us. So, what's appropriate equipment to prevent sport injuries? What about helmets, face masks, padding, knee pads, mouth guards, and what about groin area protection? I mean, those are all things that come to mind here. I'm sure the list is more than that, but there's an article that came out for prevention strategies. It was a comprehensive summary of systematic reviews on sports injury prevention strategies. And what was nice about the article that I got a chance to read or to peruse, because it's a very long article, there were 263 references. And the purpose of this review was a comprehensive review, providing sports medicine providers with a single source of the most up-to-date publications in the literature on sports injury prevention. It was a NIH link here, and I will provide, more than happy to provide the link to those that want to email me directly at AA4FL for my QRZ information. But we'll let you get access to that because it's fascinating. And, you know, we had talked about the particular single source before from the medical group at Johns Hopkins, but realize there's lots of individuals giving information. It's nice to get a comprehensive summary that's been scientifically looked at across the board on many different sports, many different age groups. And I think you'll find that this information on this particular study is very helpful. So I'm just going to quote them a little bit on the prevention strategies. They say in the United States, approximately 4.3 million non-fatal sports or recreation-related injuries are seen annually in the emergency department, and the highest rates of sport injuries in both boys and girls occur in adolescent ages between 10 and 14 years, which is likely due to increased participation in sports among this age group. And lower extremities, most commonly injured area during sports participation. However, the incidence of injury to specific body parts is really going to vary by sport. So Chip and I were talking together earlier today on our digital net. And Chip N5RTF is a psychiatrist, retired psychiatrist. He made a very relevant and important point to me. When you're talking to younger people or even young adults, middle-aged adults, an important question might be, you know, how many times have you been to an emergency room? And that will give you an idea of often to their risk from sports industries in the past, injuries in the past, because a lot of times that's the emergency room visits. And we're going to have some discussion today from others that checked here on the net. KN0S is with us, and I know has some input for that. So Dave, KN0S, if you'd like to go ahead and offer some of that input now, I'll go ahead and turn the mic over to you.
Well, thank you. Anyway, my background is in emergency medicine, and with that, we often encountered sports medicine or keeping that involved per se. We also had a program in Minnesota when I was teaching up there. So we trained the athletic trainers in how to prevent various injuries. Everything from diving injuries, how to prevent neck injuries, and the person with the neck long going into the water, how to backboard them when they came out. Of course, that time was all on the forefront, and we trained them in how to prevent neck injuries if they had a concussion. The second part of the EMS personnel, the EMTs and paramedics, and how to backboard them with the helmet in place, how to reduce the helmet at speed without hyperflexing or extending the neck, keeping the neck in good position. One of my mentors was Dr. Edwin Sheldon, a very famous surgeon. He popularized treating football players with neck injuries as well as motor vehicle accidents. How to get them on a backboard to immobilize their neck to prevent fractures. We had several cases of neck injuries. I remember it was a downhill skier who was wearing a helmet and fell, hurt his neck, complained of numbness in his feet, and when he moved him, he suddenly had a cardiac arrest on the side of the mountain. And the reason was that we had a PT fracture. So that's really trying to find out when we have to be very, very careful when people are wearing helmets and sustaining a discharge. That's something with us. We are focused to clear them up. And that's something to think about. We can only really want to often seeing firefighters come up to versus in the olden days, many of them did not wear helmets. And even in Jerusalem, the one guy from Kentucky saying that the jockey where it was on race races, you know that Playing with that to win a race, so they end up dead wrong to the jump season. But yeah, it's a size. None of them actually prevent, many of them will prevent injury, but somebody hopefully prevent death. But they will probably count that there's a lot of research on that. Even my state in Virginia, at Virginia Tech, they're working on that one like that. In the engineering department, trying to figure out how to make that safe. I'll turn it back to you. It's very first today after the hay fever. The 50 and that's like the 84.
Okay, thank you, Dave from Virginia, KN0S. Thank you for bringing that up from an emergency medicine perspective, especially the horse riding here in the Ocala area. We do go to an equestrian center, the World Equestrian Center, and it's nice to see people wearing helmets, but obviously helmets vary from sport to sport and how much protection you're going to have, and still you can have neck injuries and fatalities, but that's for another day to talk about injuries. Here we're just talking about in general prevention strategies. In this particular article about the systemic reviews, the articles that met inclusion in this review of 263 references were summarized by two major topics, both all injuries and then injuries by anatomic sites. So the articles pertaining to all injuries were further subdivided into 9 topics. They looked at sports and exercise in general, soccer, ice hockey, dance, volleyball, basketball, tackle collision sports, climbing, and youth athletics. And articles pertaining to the injuries by the anatomic site that were subdivided and evaluated were in 11 topics. And this is where we'll go in the future to talking about these particular injuries. General knee, anterior cruciate ligament, the ACL, ankle, hamstring, lower extremities, foot, groin, shoulder, wrist, shin, and elbow. So as we continue on having this discussion, and let me go ahead here and maybe take a chance here for anybody else that would like to check in and make comments and be involved in our roundtable discussion, which is part of our net here. Make your call to AA4FL, the Medical Image Radio Council, right around the net control station, AA4FL. Make your call at this time. Okay, no additional check-in. So topics like warm-ups, I mean, you would think common sense in a human fashion as we process things as human beings. You'd like to think that warm-ups would help you prepare and have less injuries rather than going in cold without warming up before an activity. But there was a 2006 study that predated this particular recent study. We were talking about the comprehensive review from 2001, and it reached the conclusion that there was insufficient evidence to endorse or discontinue routine warm-ups prior to physical activity to prevent injury among sports participants. However, the weight of evidence was in favor of a decreased risk of injury, and note that was included in the Johns Hopkins list. And further well-conducted randomized control studies will be needed to determine that role of warming up prior to exercise in relation to injury and prevention. Again, it's hard to make generalities because we're talking about different sports and different activities with different types of risks. But warming up prevent injury in sport, and through the evidence of randomized controlled trials, this particular article was from Journal of Science and Medicine in Sport in 2006. You can find that on the internet, and later we'll have a recording up on Zoom for those of you who are interested in pursuing that information. Getting back to this comprehensive summary of systematic reviews on sports injury prevention strategies, it actually appeared in the Orthopedic Journal of Sports Medicine in October of 2021, so it's recent information. And to quote the particular article, injury prevention strategies typically focus on modifiable risk factors such as rules, equipment, physical fitness. Prevention strategies may be tailored to a specific sport or injury. But exercise training involves learning proper exercise techniques, such as understanding the limits of range of motion for each joint and avoiding joint positions that place the anatomic structures of the joint at risk for injury. And exercise training usually involves some combination of strength, proprioceptive balance, and neuromuscular training that's important for improving athletic performance and preventing injuries. So obviously professional athletes are well versed in that, or I'd like to think they were, because I mean, time is money for them. They don't want to be injured. I mean, Olympic athletes want to be operating at their full capacity, but for the general public, that might be a little harder to understand those concepts. So read all you can and talk to your medical providers, and certainly if you've had prone to injury in the past, you'll be seeing an orthopedist, and the orthopedist can direct you and how to minimize the risks. But prevention strategies in this particular article, I mean, it just went down the line as we talked about it, and they found that sports and exercise in general, in terms of all injuries, had the most number of articles written about. And actually, soccer was second above basketball and tackle collision sports. There wasn't as much research review about those other sports. And youth athletes came in, athletics for youth came in slightly higher than football and basketball and volleyball, dance and soccer, but no, not soccer. I mean, soccer was high above that in the terms of articles. So more research is really needed. What about by anatomic site? I mean, where were most of the articles focused on? It was ACL was the highest count, the anterior cruciate ligament. So it must be a very common injury that's researched. And after that, we have the ankle and hamstrings, lower extremities, and general knee. Much lower was the foot and the groin and the shoulder and the wrist and the elbow. And there's some interesting folk type information to talk about a little later when we talk about the groin, talk about helmets, and you might get a little chuckle when we bring that up. Helmets and concussions. So what are the effectiveness of protection for youth? I mean, is developing brain at more risk? Yeah, Bob K4RLC was on earlier, and he talked about the significant issue with prevention because there's a lot of junk out there. People trying to sell products to parents and school systems to prevent concussions that may actually be worthless. And some may actually increase the possibility of concussion or other injuries. So what you find on the internet or what you find from sales contacts is not necessarily in the best interest of the person you're trying to protect. So while some of the persons may be well-meaning, but some may not. Profit is a ulterior motive, unfortunately. But all prevention techniques need to be based on good empirical research. And as mentioned here by Dave, KN0S, Virginia Tech leads the way in empirical and biophysical evaluation of football helmets. Now, Virginia Tech is an excellent engineering school. I know at the University of Florida, some of the projects I've been involved in with satellites, Virginia Tech has been part of the team and working up those projects. There's no such helmet or device that prevents concussions, but in fact, childhood concussions are fairly common outside of sports as well, due to many factors. When you have ADHD, impulsivity in those particular subset of children, of kids. Children have large head to neck ratios, which puts them at greater risk. Often their balance isn't fully developed. They might have poor balance, and basically children do occasionally goof around. And you can see the new design of children and children's playgrounds at Parks Elementary Schools to try to keep that design to prevent injuries. So as Bob and Alana, who are specialists in the field, and Alana particularly in terms of child protection of injuries, as a neuropsychologist and somebody that works actively at the state level with legislation. These are considerations to be discussed in the future panel discussions on concussions. And let's identify here. This is AA4FL from the Medical Amateur Radio Council, Grand Rounds on the Air. Are there any, we still have a few more areas to discuss. Do we have any questions on the air? That would, anybody would like to ask a question at this point, make a call to AA4FL. Okay, no current questions here, and thank you for everybody that's participating in that. Those of you that are checked in and those of you that are listening as well. There was another article in Current Sports Medicine Reports from December of 2012 that was demystifying the preventative equipment in the competitive athlete. So as you go on the internet, you can research, but again, it's hard as a non-professional to know what's relevant and what's not, and to weight the importance of it. And what they say is sports-related injuries are rising as the interest and participation in sports rise. Recent epidemiological studies suggest that 1 in 5 injuries in individuals 18 years or younger reporting to the emergency department were found to be sports-related. I think Dave KN0S brought that up as a relevance, and N5RTF as well. Chip in New Orleans has brought that up. But the injuries were found to account for up to 19% of primary care injury-related visits. In the article here that they talked about, sports equipment for prevention and injuries, in that particular article, they reviewed 5 different types of sports protective equipment: ankle support, knee support, mouth guards, eye guards, and helmets. And the protection provided each with a level of evidence. And they found that the literature actually supported the use of ankle braces and mouth guards in athletes. The use of knee braces and eye protection in some athletes is indicated. You got to consider the sport. We'll talk about helmets and football and over the evolution of helmets and how they were designed not only to prevent head injuries from a standpoint of traumatic brain injury and concussion, but also being poked in the eye. But it's uncertain that if all these designs give complete concussion prevention. In fact, we know it's not. And what about soccer? I mean, in soccer, headgear is not supported. It needs randomized control studies to show benefit. But how would you wear headgear in soccer? I mean, using your head is part of the game. I wouldn't see how you could possibly do that and do a header. I'd bring a new definition to the term header, I would think. So I'm curious if this study, I can't remember if it originated in the UK, but one might think so. But the conclusion of this particular article is to wear or not wear preventive equipment is a question in sports, and the literature supports the use, as we said, of ankle braces to reduce ankle injuries without performance decrement. Mouth guards are important to reduce the rate of dental or facial injuries in athletes, but not necessarily concussions. And I can tell you as a dentist that I've seen oral facial injuries from not wearing mouth guards, and I've had to reinsert teeth that were knocked out and stabilize teeth that what we call subluxated or moved and reposition them and deal with the root canal issues and the issues that happen within the roots of the teeth afterwards. But the use of knee braces and eye protection in some athletes, as we just talked about, some athletics is indicated. But eye protection particularly is useful in squash and lacrosse. But anything that you've got a stick, I mean, what about hockey? Face masks, face guards. They might be clear now, but you'll see them in NHL games. And helmets to prevent head injuries are supported, but still uncertain in some sports that does not prevent concussions. But the world certainly has been making a lot of progress. Research like is being done at Virginia Tech. This article was 2012, and I'm sure there's been lots of progress since in professional athletics. And we'll talk a little bit more about that. But soccer headgear will need randomized control studies to show the benefit versus harm, but I don't know how you would prevent concussions because you're going to have to head. You're going to have to header. I mean, you're going to take a foot to the head, I guess, occasionally, but how can that happen in that particular game? But going to helmets, again, this is AA4FL identifying for the Grand Rounds on the air. Now, do we have any late check-ins before we go to talk about helmets? Okay, go ahead and check it. Okay, Kilo Fox 5 Delta question mark Charlie. What's the middle initial?
Mexico, Italy.
Okay, let me make sure. Kilo Fox 5 Delta Mexico Charlie, is that correct?
My name is Paul.
Well, Paul, thank you for checking in and being part of this discussion. The Medical Amateur Radio Council's Grand Rounds in the Air Net. Did you have any particular question you wanted to ask before we continue on with discussing helmets? Go ahead. Okay, Paul, thank you for checking in. We're going to talk a little bit more here, and then we'll pick up more questions in time to interact amongst those that are listening to the net here today. But in football, some players wore leather helmets in the 1920s and early 1930s, and they progressed from softer to harder leather, and then to plastic in 1939. And it wasn't until 1943 that the NFL required players to wear helmets. And 1955, they were required to have a single face bar, and that progressed to 2 bars, or at least a minimal face mask to prevent against eye injury, poking the eye in 1962. And the design improvements continue this day to cushion against impacts and improve face masks. The concussions from impacts continue to be an issue. It's a high impact sport, and you know about targeting now, especially in the college level for participation, because the injuries and the impacts are so severe. How do you protect against the trauma involved in those type of collisions, even when you have a well-padded or well-designed face mask? And kudos for entities like Virginia Tech that are researching the engineering of that. But helmets were a rarity in the NHL. This is where I'm going to come in with a little bit of a folksy input. Because the early years, the first one was worn in 1928, but really almost no one wore them. A small number of players wore them in the 1930s. And unfortunately, in 1968, a player died from a game-time brain injury. And the perceptions of a need for helmet use became more prominent. And by 1979, 70% of the NHL players wore helmets, but they just started to become required in that year. And the requirement was only mandated that new players wore helmets. Players that already existed without wearing a helmet, that were already in the league, were not required to at that time. And in 1988, new referees were required to do so, but with that same caveat: if you didn't wear one before, you didn't have to. So the last player to not wear one was in the 1996-97 season, the last referee in the 2006-2007 seasons. Those are original participants that weren't required to wear them had retired. They're very interesting in the folksy aspect of this. And my daughter is an attorney, and she was involved in a law firm that was doing the class action lawsuit against the NHL. So testicular guards were introduced in hockey in 1874. And since that's many years before helmets were available, what does that say about hockey players? And then it's talking about that lawsuit. 10 former National Hockey League players claimed in a class action lawsuit that the league hadn't done enough to protect players from concussions. And the lawsuit sought damages and court-approved medical monitoring for their brain trauma and their injuries, which they blamed on their NHL careers. And granted, the NFL had already had a separate lawsuit by then. And it brought this to the forefront. But they were wearing cups protecting their testicles for years before, but not protecting their heads. So it's an interesting commentary on male dominance in sports at the time. So what about mouth guards? I mean, they're referred to as athletic mouth guards or mouth protectors. So what sports would you wear them? I mean, think about all the sports where your teeth can be at risk, all the contact sports, but just about anything you can have an injury. Young children, when their teeth are developing and first coming in, and those upper front teeth, they often flare out. They even have a segment developmental time where it's called the ugly duckling stage. Their teeth flare out so badly, so they're at particular risk for trauma. So they usually make those guards for the upper teeth. There are stock ready guards that you can just buy over the counter. They're not personalized at all for the participants. They offer the least protection. But there are also thermoplastic boil at home and mold material guards that you can pick up at sports stores that allow the wearer to partially personalize the protection of the teeth to conform it to your own. But the custom-made guards made by dental impressions by a professional offer the best fit and protection. Of course, they're also the most costly, but regardless of those three options, the mouth guards are only helpful if you actually wear them once they're made. And that's a sad commentary if they're made. We're going to go ahead and hear from our members and guests. And thank you for everyone that's participated. Look for the video. There's a YouTube channel, a Healthcare Hams, and if everything's gone well with our recording today that we're making, it's at youtube.com/the Healthcare Hams. So you'll be able to do that if you're on coming in through HF here today. You may not be been able to hear all the speakers, so hopefully the YouTube video would pick up all the speakers. So at this time, do we have any further discussion on the subject? Make your call to AA4FL. We'll start a list.
For RLC.
Okay, K4LC. Go ahead with some follow-up discussion there, Bob.
Well, Jay, you really do your homework. The one I was watching, and I'm learning stuff listening to you more specific that first minutes, but we'll cover some of this stuff, I guess, in November. But there's so many things out there. Some of the biometrics, some of the mouth guards. I don't know if you saw them. They do telemetry, and we put telemetry in the football helmets, and especially over Chapel Hill, and found that each person sort of has a concussion threshold in terms of G-forces, and some guys can take a huge amount of G-forces and some are minimal and have difficulty. Rugby has fewer concussions, and there's a big debate about whether American football gets people this gladiator approach with all the stuff, and then rugby you hardly have anything. And then one more I'll put is the early childhood stuff. I don't know if you've been to the CDC website. The CDC website, I haven't been there recently, but really covers like 0 through 50. And we really look at the preschool or elementary school injuries that you mentioned, and you did a great job with that before organized sports kicked in around middle school. And all the dynamics there, and how engineering really has helped a lot. Virginia Tech has been great, and stuff coming out of Chapel Hill. And I'm gonna,
The frequency is in use
for 10 years, and I'm gonna be defensive, but we did a really good job taking care of players. If you want to think about a high velocity, high conflict sport, hockey's a big one, and just.
Frequency is in use.
Up at that, you may like this at the dentist. Some of the guys, when they got their teeth,
The frequency in use from the middle of the net.
had them sit through the season because they thought it made them look tougher not to have all their teeth in. And that just is the psyche of a hockey player. Thanks a lot, Jay. K4RLC back to net.
Okay, thank you very much, Bob, and thank you for those of you that are allowing us the use of the frequency for our Medical Amateur Radio Council Grand Rounds in the Ear and Net that takes place during this hour every Sunday and has for years. And we appreciate your patience. And thank you, K4RLC and Alana, K4AAC, operating from a park in Western North Carolina. And unbelievable that we have the propagation for that portable setup to have such an excellent signal here into Florida today. And that bodes well for your POTA activation, Bob. So go off and have some fun. And as Bob mentioned, we are going to have panel discussions, and we'll particularly have one that they're heavily involved in leading the way, actually, as specialists on sports concussions. We'll have that set a date for some time in November and let everyone know. Do we have any other further input, people that would like to discuss a particular aspect of the information we've talked about today? This is AA4FL from the Medical Amateur Radio Council, looking for people that like to ask questions. Okay, well, thank you very much for everybody that participated today, being that this is an amateur radio frequency. We don't want to hold frequency for any longer than is necessary. So we're going to go ahead and stop the presentation today, the discussion today, actually, our roundtable discussion about preventing sports injuries. And we appreciate everybody that participated. It was actually a very lively discussion with a lot of participants from many parts of the country today. And we have a lot of expertise within our group of hams, and again, being an ARL affiliated club, we like to be involved and show our passion for radio, but also our passion as amateur radio operators for health-related considerations. And we're a group of amateur radio operators who our friends like to talk about on the air our passions, just as all other amateur radio operators like to talk about their passions on the air. It's not a business thing. It's not a pecuniary or financial consideration, but we'd like to think that if the side benefit is for all amateur radio operators. So at this point, I'm going to bring the net to a conclusion for the Grand Rounds in the Air. We will not have a net next week because there is a contest, but we are going to have some interesting upcoming nets. One will be on the General Mobile Radio Service, the GMRS service, which many hams are not familiar with, but that is sort of parallel, sort of an enhanced CB. We'll go through all those details because in emergencies, particularly local emergencies, it can have a very prominent spot. The ham should be aware of it because the equipment is actually fairly similar. And with the licensing, you can get on that and there's no test involved, just submitting. So that will be one of the upcoming. We will be posting a list of our next quarterly presentations in the October issue of the Ether magazine, Ether publication. Everybody check the website for the Medical Amateur Radio Council, just Google that, and you'll have access to the July edition, which outlined these particular 3 months this quarter. But quarter by quarter, we try to announce our topics in advance. That's 7-3, everybody. Have a wonderful Sunday and remainder of the weekend, and then a nice upcoming week. This is AA4FL for the Medical Amateur Radio Council, bringing that to a close for today. 7-3.